Okay, so prior to entering into the patient's room, I would grab all my supplies and gather it, so when I went into the patient's room, I had everything I needed. So I do have my supplies already gathered. We're just gonna go ahead and get started. So I'm gonna knock on the door. I'm gonna come in and introduce myself. Hi, my name is Jessica. I'm gonna be your student nurse, and I'm gonna be changing your dressing and doing tracheal suction. So I would ask the name and the patient's birthday, and then I would verify that I have orders to do those things in the computer. At this time, I would wash my hands. I would put on gloves. And I would raise the patient's bed to a semi-Fowler's position. And so I'm just going to go ahead and remove the pillow. Place a roll towel under his head just so he doesn't aspirate or at risk for aspiration. Then I'm also going to place one over his chest. So at this time, I would also place my pulse oximeter. And I would listen to his breath sounds, or his lung sounds. Okay, so at this point, I would take off my old gloves and put on my mask. Doesn't feel right. This thing is so hot. Okay. So this time I'm just going to set up my equipment real quick. I sit by the bed. Make sure that my suctioning is working. Okay. Alright, and then I'm going to remove this and give the patient 2 breaths. So I just want you to raise your hand if you feel like you need me to breathe for you, and I definitely can do that. Okay, so at this time I'm just going to set up my fields. Open them up. And these are sterile gloves. I'm just going to set them aside for right now. And open this up. So now that 1 inch around my sterile field is unsterile. Alright. Okay, so I'm going to drop my supplies onto my sterile field. Okay. And at this time, I'm just going to take some of my sterile water and fill it in here and in here. And my peroxide will go in here and in here. Okay. So I also need to open up my other field. And before I get started, wait a second, before I get started. So I'm going to put sterile water in my container. All right. And then I'm going to put on my gloves. So this sounds sterile. I can touch that. Alright. So that can now be fixed. Okay. Alright. So now my pinky, I know, is now contaminated. So I won't be using my pinky, but my hands are sterile. Okay, so I know I can touch the stuff that's on my sterile field. And so my gauze pad, 1, 2, and 3, I'm going to be putting into my sterile water. My Q-tips will go into my peroxide. All right, and I'll be opening this. All right. Okay, so I need to connect this to my suctioning. And I'm going to bag my patient. Now I know that this end is dirty, so I'm going to be bagging my patient real fast. Okay. All right. So I'm taking water in to lubricate the tube and also to make sure that suctioning is working. Okay, so before we get started, I need to keep my catheter tip sterile, but I also need to remove this. And this just goes in my peroxide and sterile water. Okay. Am I still doing all right? Okay. So I'm going to go ahead and insert this 4 to 6 inches. And when my finger is over it, it's working. When it's off, it's not. So I'm just going to go ahead and suction them. Okay. And then I'm going to get more sterile water. Okay. And I'm going to suction one more time. Okay, good. So at this point, I need to listen again for his lung sounds. So his lungs sound clear. So at this time, I'm just going to go ahead and wrap my suctioning equipment into my glove. And I'm going to take that off. That will be garbage. Okay, so another glove. I need another glove for my hand. I no longer need to be sterile, so I'm going to take his tube and clean it. And I'm just making sure that it's still in one piece, that it's not damaged. I'm cleaning out the gunk, and I'm looking at what's coming out, noticing the color, just making sure that it's nice and clean, and that can go in the garbage. So then this would be rinsed with my sterile water through the tube and on the outside of the tube. And then it could be replaced. So I'm also going to be changing his dressing at this point. And I'm just going to go ahead and hyperventilate him again. So we're going to go ahead and just do the dressing real quick. So what I'm going to do is remove the old dressing, and I just want to make sure to stabilize the trachea. And this I'm going to keep. I'm just looking for color, odor, characteristics of the drainage that was on there. Then I'm going to take one of my Q-tips and peroxide, and I'm just going to roll it to clean around the stoma. So I'm looking at the stoma itself. I'm looking at the condition of it. I'm looking to see that it's intact. Just rolling it to clean it. And then I'm going to take my sterile gauze and just clean around where the peroxide was, so there's no breakdown at the site. And again. Okay. And then I'm going to take my new dressing and just stabilize that as I put the new dressing on. This. Okay. So at this time, I've changed the dressing. I've suctioned him with sterile suctioning. I would remove my equipment. Everything would be thrown away. I would also check just to make sure that his oxygen is back up where it needs to be, and it is. It's back at 96%. So I'm going to take that off. His color seems to be much better. His lungs sound much better. Lift up his head. So then at this time, I would also document. I would document his response to it. I would document the color and the characteristics of the secretions that I got out. I would document where his oxygen was at after I suctioned, and where it was at prior to suctioning. And that's it.